Hello, today we'll be learning about endodontic complications, which is root canal treatment. Disclaimer: the given information may not be verified exhaustively by experts. Doctor must be informed whenever patient experiences any of the following complications. Complications are mostly rare and can be avoided if patient comes for a 6-monthly checkup. Most of the complications are manageable and rarely it may lead to a lifetime of debilitations. List is exhaustive, not to frighten you but necessary for informed consent. Intraoperative complications happen while the root canal treatment is being carried out. Postoperative complications happen after the root canal treatment is completed. So various authors have given success rates for root canal treatment between 95 to 99%. In retreatment, failure of root canal treatment can be up to 25%, and the chances of complications are far higher and the cost rises dramatically. In case of a failure of a root canal treatment, it has to be replaced by an implant. Please note that the cost of management of complications, if any, is not covered in treatment charges. Intraoperative complications are further classified as hidden canals, which are inaccessible canals, hidden caries, damage to existing restoration and crowns, access related, which are when entering the pulp chamber of the crown of tooth, over and under instrumentation, instrument separation or fracture, and tooth fracture during instrumentation, ledge formation, over and under extended root fillings, irrigant related mishaps, or accidental swallowing of foreign bodies, and acute pain. Postoperative complications are as follows. Number 1 is pain, number 2 is swelling, number 3 is sensitivity or numbness. So coming on to the access related, in which the chances are minimal. Inaccessible canals can be due to calcified tortuous canals and may cause inaccessibility and long multiple sittings. Number 2 can be because of hidden caries. Number 3 is damage to existing restoration or crown. So rotated tooth and subgingival proximal decay have higher chances. Number 4 is access related perforation. It can be caused due to anatomical anomalies. These are basically when entering the pulp chamber of the crown of the tooth. Number 5 is damage to adjacent hard and soft structures. These are easily managed. Coming on to instrumentation related, the chances for which are minimal. So the number 1 under it are over and under instrumentation. Number 2 are separation of instruments. Retrieval of separated instruments depends on the point where instrument is fractured and region of the tooth where it is present. Accordingly, it is retrieved or bypassed or surgical intervention is required. Tooth may need extraction also. Number 3 are root perforations and number 4 are ledge formations. Coming on to obturation related complications, the chances for which are minimal again. It can be underextended root canal fillings or overextended root canal fillings. Coming on to irrigant related complications. Occurrence is common to very uncommon. So some patients have unknown allergies from certain irrigants. Irrigant can also get into the tissue space that can lead to swelling. Post-operative complication. Number 1 is pain, which is mostly manageable. Number 2 is swelling, which is again manageable. Now patient has to come for regular visits as and when advised. Coming on to accidental swallowing of foreign bodies. So specialists have determined that if swallowed accidentally, 87% of foreign bodies enter the alimentary canal, which is the food pipe, while 13% is aspirated into the respiratory tract, which is air pipe and lungs. Literature also showed that although 90% of ingested foreign objects could pass through the stomach uneventfully, there are roughly 10% chances that it requires endoscopic removal. In this procedure, an instrument is introduced into the body to give a view of its internal parts, while 1% will ever require operation. Now, accidental swallowing can cause some serious complications and can eventually even lead to death, particularly if it goes into the air pipe. Patients with pregnancy, obesity and sliding hiatal hernia are also at greater risk of aspiration or ingestion of foreign bodies. Immediately inform the doctor in case of accidental ingestion of foreign bodies. Coming on to periapical lesion. So the presence of periapical lesion in which the size, extent, content of the lesion may significantly affect the prognosis of the tooth. Misdiagnosis during procedures and anatomic variation can always throw misjudgment and may happen at the hands of an experienced dentist. So although this is an exhaustive list of complications, a complete list is impossible to make, and there may be certain complications waiting to happen which are not yet listed in the literature. If you have any further questions, please write back to us by mail. Thank you.